What is chin augmentation? Chin augmentation is an increasingly popular procedure for both men and women and can have a dramatic and beautiful impact on overall facial aesthetics. Chin augmentation can be performed in isolation, or it can be done as an adjunct to other aesthetic procedures, such as surgical or liquid rhinoplasty, buccal fat removal, a facelift, or neck liposuction. Younger patients with small chins may need only chin augmentation to enjoy noticeable and beautiful results. However, in some patients desiring complete facial rejuvenation, chin augmentation may be only one component of their total surgical plan. Here's a quick guide. What's the meaning of chin augmentation? Chin augmentation, also called genioplasty or chin enhancement, refers to a cosmetic procedure of reshaping the chin with either injectable dermal fillers, custom-fitted implants, or bony advancement surgery. These procedures are performed to create a stronger chin and a stronger anterior jawline and the appearance of greater lower jaw projection. What is a chin implant? A chin implant is a custom-fitted biocompatible implant, usually made of a silicone derivative that is surgically inserted into the chin and over the patient's bone to create the appearance of a stronger lower jaw and chin. The implant can be placed through either a small submental neck incision or through the mouth with an intraoral incision. I prefer the submental incision, as the skin in the neck can be sterilely prepared, whereas it's difficult to sterilize the intraoral bacteria. Incisions may get infected more. What are some chin implant considerations? It's important to have a dedicated preoperative consultation that looks at the chin and jawline as they relate to other facial features, such as the lips, the other soft tissues, the neck soft tissues, and the nose. Facial balance and harmony are the keys. There is no ideal chin size. For this reason, each individual should be looked at, examined, in order to decide on the best three-dimensional chin size, chin shape, and chin position. Because individuals look at themselves primarily from the front, as they're facing a mirror, they often do not recognize the impact of chin and jawline size and position on their overall facial attractiveness. For this reason, patients don't always ask for chin augmentation. However, if they looked at more photographs of themselves, certainly photographs from the side, but even obliquely, many more patients would desire this procedure. It's not coincidental that most models, whether female or male, have strong and defined chins and jawlines. And it's a little known fact that no United States presidential candidate with a weak chin has ever been elected. It's therefore important that the surgeon look at all the facial features to suggest the best overall plan. It may be slightly reducing the nose and augmenting the chin for a better profile and better facial balance. In a middle-aged patient who doesn't like the heaviness of their lower face and neck, it may be augmenting the chin in conjunction with a neck and lower facelift. Lastly, I see many patients who have weak chin who get their lips augmented. Too much lip augmentation in a patient with a weak chin causes an unnatural appearance. In these patients, I suggest augmenting the chin and jawline first, and then deciding if the lips even need to be augmented. Can I get chin augmentation without surgery? You can, of course. Chin augmentation can be very well performed with injectable fillers. The advantage of injectable fillers are that these can be performed in an office visit without sedation, without real anesthesia, and the patient is able to drive themselves home. The other advantage is that they provide three-dimensional chin augmentation, projection, length, and widening in a way that implants cannot fully reproduce. The disadvantage of injectable fillers is that their results are not permanent, and if the patient likes them, they will need to have them reperformed at some point. However, the advantages of the immediate result and three-dimensional correction with injectable fillers are significant. Injectable filler augmentation of the chin can be termed liquid chin augmentation. In a liquid chin augmentation, filler is injected into and around the chin to give the whole lower face a fuller and more lifted appearance. Liquid chin augmentation is temporary, but many clients actually prefer that as it allows them, in effect, to preview the results of what a permanent chin implant may look like before they actually commit to that surgical procedure. What is bony advancement surgery? Bony advancement surgery, or bony genioplasty, is a procedure performed through an intraoral incision in which the chin bone is cut with a bony saw, and the bone is advanced forward or forward and down, and then it's fixed into position with surgical screws and a plate. I think this is an important thing for the surgeon who can perform all these procedures, because bony augmentation works very well for patients who need a large augmentation, better than a chin implant. It is also the only procedure that can be performed to contour a chin and to make it smaller. So if we've got macrogenia, we can contour it and make it smaller with bony genioplasty. The procedure of bony genioplasty takes only 30 minutes to complete, but there's a more prolonged downtime and more interruption of normal intraoral function than with either injectable fillers or than with a surgical chin implant. I feel that it's very important for a surgeon to know how to do bony surgery for complex chin deformities or for a very large augmentation. What is recovery time for a chin implant or for liquid chin augmentation? The recovery time for chin augmentation will depend on the type of procedure you have done. With a liquid chin augmentation, meaning a chin augmentation performed with fillers, there's virtually no recovery time. Patients often go back to work the same day, and any residual bruising or swelling is slight, it's short-lived, and it's very easily concealable with a slight amount of makeup. For a chin implant done under local anesthesia with a submental incision, the recovery time is a bit longer, but not by much. With a surgical chin implant, an incision is made just beneath the chin in the anterior neck skin, and a pocket is made over the chin, just fitting the size of the implant. Usually, a sizing implant is placed before the actual implant is placed to determine the best size. I may have it down between two sizes, try each of them, and decide what looks better. Once the sizing implant is placed and the contour is felt to be good, an implant of that size is opened, rinsed in antibiotic solution, and placed snugly into the pocket. The implant is then sutured to the bone lining, and the wound is closed in a couple of layers to protect the implant. The incision length is very short, and the resulting scar is almost unnoticeable. So while patients shouldn't have any visible scars or sutures, may have more significant swelling and bruising with a chin implant than they do with liquid chin augmentation. As a general rule of thumb, patients getting chin augmentation with a surgical implant can expect to be mostly healed in about 1 week. Will people be able to tell that a patient has a chin implant? If you go to an experienced practitioner who's done many chin implants, then the chin implant should not be noticeable later. My goal is to have my patients go to a social event after surgery and have others say, "Oh wow, you look amazing, what have you been doing?" Not, "Oh, your chin looks bigger." What results should I expect with a chin implant? A well-fitted and well-placed chin implant should look entirely natural. Some surgeons are far too aggressive with the size and the shape of the chin implants they place. This is not only aesthetically obvious, it can also be costly and dangerous if the chin implant migrates and if the chin implant later has to be removed. Always be sure to go to the very best chin augmentation surgeon in your area if you're considering a chin implant. Don't be shy about asking the surgeon how many of these procedures he has been performed and to look at before and after photos. Do you have questions about chin augmentation? I work with patients like you every day. Please call me. Please email my office to schedule a consultation. I really look forward to seeing you in my office. Thanks for watching.